Hello everyone. I'd like to start by saying a big thank you to the team behind the International Journal of Prosthodontics for this opportunity to #bring the journal to life. In particular, Irene, Eva and Helena. This is a great initiative which I'm sure many clinicians will find useful and will be looking to get involved with. So without further ado, let's get into the article I will be appraising today. And the article I will be discussing is from the Department of Prosthodontics and Material Science in Leipzig, Germany. And the authors Rauch et al. Have written this publication to assess whether monolithic zirconia restorations affect temporomandibular joint disorders and their signs and symptoms. Now, since the widespread introduction of zirconia for dental prosthesis to target the need for a more functional and aesthetic restoration, much research and comparisons have been done against other more traditional materials. And initially, zirconia in its veneered form was actually shown to carry more complications than even metal ceramic restorations, especially with regards to chipping of the material. Therefore, the emergence of zirconia and its use in its monolithic form came about and has so far shown superior wear resistance to other restorative materials and to even teeth. However, with its superior strength, many have attributed a potential role of zirconia restorations in the deterioration of the masticatory system. And specifically, thoughts are that they could trigger or even worsen existing temporomandibular joint disorders. Hence, the authors set about to test the hypothesis that there was no effect of posterior monolithic zirconia-based fixed dental prosthesis on the signs and symptoms of temporomandibular joint disorders. And they were observing this in the short to mid-term at 1-year recalls. Now, with regards to the cohort of patients, a total of 50 participants were included, all of whom required a single monolithic zirconia fixed dental prosthesis. And all of these were supported by either 2 or 3 abutment teeth. And the bridges were designed to match the anatomy and occlusal scheme of the adjacent and opposing teeth. Now, when assessing the participants for any TMJ disorders, symptoms were assessed by asking a single question. Do you have pain on the right side of your face, the left side, or both sides? And clinical signs of any TMJ disorders were based on the palpation of the muscles of mastication and around the lateral pole, as well as evaluation of any sounds from the joint, including crepitus or clicking, especially when opening and closing. And then the exact same evaluations were recorded at the year recall. Of the 50 participants, 43 presented for that 1-year recall. The findings have been highlighted in the table, but of note, the patient's facial pain perception had gone, and there were no new reports of facial pain, which was based again on that initial question of, do you have any pain? And even though some pain in the muscles and joints were detected at the recall, mainly on palpation of the muscles or around the lateral pole, this was not deemed to be statistically significant. TMJ sounds, including the click or crepitus, had actually been shown to decrease in comparison to the baseline as well. So the results of this study suggested that there was no real effect of these monolithic zirconia restorations on TMJ disorders with regards to the development of any signs or symptoms. And how is this clinically relevant to our practice? Well, encouragingly, it seems that single zirconia FDPs have no effect on TMJ disorders and would therefore be safe for continuous use in patients who may present with signs of TMJ disorders. Of course, the follow-up of these subjects was relatively short, so longer observational periods would be more useful. And also, considering this study looks mainly at single quadrant or sextant prosthesis, it would be interesting to see what effect full arch zirconia restorations may have, and especially if it is a tooth or implant retained prosthesis. So again, a big thank you for taking the time to watch this presentation, and again thanks to the whole EAO community and the guys behind the International Journal of Prosthodontics for this opportunity. Till next time, I hope everyone stays safe. Goodbye.